Assalamualaikum warahmatullahi wabarakatuh. We are from Group 1. We'll be presenting Case Study 1. This is our group members which consisting of Fatin Nabila binti Osman, Nur Adani Akila binti Aris, Nur Adila Atira binti Mat Ali, and Wan Nurul Husna binti Wan Shukri. Throughout this presentation, we will be discussing about diagnosis, definition of the disease, examination, and treatment of the disease. Based on the case study given, there are several abnormalities that we came across the patient's data. First, the patient is an elder at the age of 61 years old, so she is very prevalent to age-related disease. She also experienced mild eye burning feeling after reading for long periods of time or in the afternoon. This symptom is actually very general to many kind of diseases and also might related to aging process. Next, the patient had undergone a cesarean delivery due to her past medical history with hypertension. This might indicate that the patient probably have glaucoma. Since the patient is quite old, it is expected that she is having a presbyopia. Next, the gonioscopy result shows that the patient has an open angle with minimal pigmentation of trabecular meshwork. This is a huge indication of primary open angle glaucoma and there was no synechiae detected. The IOP or intraocular pressure of the patient is also quite high with 21 mm mercury right eye and 23 mm mercury left eye. With the normal range of 0.3 until 0.5, the cup-disc ratio of patients' both eyes are quite big, which are 0.7 for right eye and 0.8 of left eye. The picture here shows an illustration of open angle glaucoma and angle closure glaucoma. Next, the slit lamp test shows the patient is having a grading of 1 plus nuclear sclerotic cataract, or in other words, she's having a mild cataract, and we assume that the cataract is caused by the genetic inheritance since based on her past family history, her parents had undergone a cataract surgery before. After that, the visual field test shows superior arcuate defect on both patients' eyes. This is a high indication that the patient might be having a glaucoma. We had concluded that the possible diagnosis of this patient is she might be having a primary open angle glaucoma and cataract, while the differential diagnosis is ocular hypertension.
Next, let's move to the definition of condition that the patient is having. Before we jump into the meaning of the disease specifically, we need to know what glaucoma is first. So, glaucoma basically is a group of conditions in which there is characteristic of cupping of the optic disc with corresponding visual field defects due to retinal ganglion cell loss. It is a progressive condition and one of the most common causes of permanent vision loss across the globe. Meanwhile, primary open-angle glaucoma, or POAG, is a subset of the glaucoma defined by a wide, open and normal appearing anterior chamber angle and raised in IOP or intraocular pressure with no other underlying diseases. So, this is the common anatomical condition of the primary open-angle glaucoma, which is due to the blockage of trabecular meshwork, which is caused by the loss of trabecular cells that are responsible for the opening of the pores for drainage of aqueous humor out from the eye. There is no anterior or posterior synechiae that blocks the flow of aqueous humor, and the angle between the iris and cornea is in normal condition and no abnormalities detected. The next condition of this elder patient has is nuclear sclerotic cataract. It is the most common type of age-related cataract caused primarily by hardening and yellowing of the crystalline lens over time. Nuclear is referred as gradual clouding of the central portion of the lens, which is called the nucleus, and sclerotic on the other hand means the hardening of the crystalline lens, which together they lead to the disease called nuclear sclerotic cataract. So, the question is there any relationship between glaucoma and cataract? As we know, both diseases will result in permanent vision loss if left untreated. However, glaucoma itself does not cause cataract. Same goes to cataract, it does not cause the patient to have glaucoma. Nevertheless, both diseases can appear at the same time, and conditions such as hypertension and aging may increase the risk of having both nuclear sclerotic cataract and primary open-angle glaucoma. Moving on to the differential diagnosis, which is ocular hypertension. Ocular hypertension is defined as an intraocular pressure of the eye of more than 21 mm mercury, which is higher than normal, but still have a normal optic nerve condition and normal visual field, which not seeing to cause any defect to any ocular structure.
Okay, the next one is process of examination primary open-angle glaucoma. To be safe and accurate, there are 5 factors should be checked before making a glaucoma diagnosis. The first one is tonometry. Tonometry is used to measure the pressure inside the eye. Most glaucoma cases are diagnosed with pressure exceeding 20 mm mercury. However, some people can have glaucoma at pressure between 12 to 22 mm mercury. As in this case, the IOP value of this patient is 21 mm mercury in the right eye and 23 mm mercury in the left eye. A difference in pressure between the two eyes of 3 mm mercury or more may indicate that additional evaluation is necessary. Early primary open-angle glaucoma is very likely if the IOP is steadily increasing. Next is ophthalmoscopy. Ophthalmoscopy is used in a diagnostic procedure to examine the shape and color of optic nerve. Higher pressure in the eye may lead to optic nerve damage in glaucoma. Okay, this is perimetry. Perimetry is a visual field test that produces a map of complete field of vision. Okay, the picture on the right side is the example of the superior arcuate defect visual field in glaucoma. This is corneoscopy. This diagnostic exam helps determine whether the angle where the iris meets the cornea is open and wide or narrow and closed. Okay, the last one is optical coherent tomography, or also known as OCT. OCT is used for imaging of optic nerve and the nerve fiber layer and ganglion cell layers of the retina. This is a newer technique that is quick, painless, and objective. This can discover early changes in structure, which may indicate that the treatment of ocular hypertension is necessary to prevent glaucoma.
Okay, next we move to the treatment of the possible diagnosis, which is the primary open-angle glaucoma. The first treatment is by using medication that usually in eye drop form that we also known as topical drugs. So this topical drug will lower the eye pressure in glaucoma patient by improving the drainage of the aqueous humor or slowing the formations of the fluid. However, this eye drop may have some side effects. So the usual side effects are transient burning, stinging, or blurring of the vision on the administrations of the eye drop. The other side effects are also itching, redness, or allergic reaction. So the first drug's mechanism of action is by improving drainage of the eye fluid. The drugs used are usually prostaglandin analog. So a few examples of the drugs are latanoprost, and in the bracket is the brand name of latanoprost, which is Zalatan, bimatoprost, and also travoprost. Next is medication that will reduce the eye fluid formation. For example is timolol, dorzolamide, brinzolamide, and brimonidine. And they also have the combination eye drop, which combine two drugs in one eye drop. For example, dorzolamide and timolol, latanoprost and timolol, brimonidine and timolol, and also the last one is brinzolamide and brimonidine. They also have oral drugs, but it is less commonly used. So the example are pilocarpine, acetazolamide, and also metazolamide. For the second treatment is by doing surgery. So there are two of the most common glaucoma surgeries, which are trabeculectomy and tube shunt surgery. So trabeculectomy is an operative procedure that improves the drainage by creating the trapdoor in the wall of the eye. So the fluid is shunted from inside of the eye past the obstructed trabecular meshwork to the space outside of the wall of the eye, but under the outer membrane covering the eye, which is the conjunctiva. So the drainage under the conjunctiva will cause a blister or bleb, like we can see in the picture, to form, which is usually under the upper eyelid. And for tube shunt surgeries, they are basically like trabeculectomy, but involve the implantation of the tube that shunt the fluid to the outside of the wall, but inside the conjunctiva. As we can see in the picture, there are the tube there. So tube shunt are often successful when trabeculectomy fails or in some form of glaucoma where trabeculectomy does not work well. So next is minimally invasive glaucoma surgery or MIGS. So the benefit of MIGS is it can increase the safety in the trabeculectomy and tube shunt surgery. There are so many potential complications that can happen because they are major surgery. So by using MIGS, the complication can be reduced because MIGS procedure work by using microscopic size equipment and tiny incision. So the example of operation under MIGS are microtrabeculectomies, trabecular bypass surgeries, supracorroidation, and laser photocoagulation, which is for advanced glaucoma. And for example, in this patient that have cataract, in some operation of MIGS, it can be combined with cataract surgeries. So for the last treatment is by using implant, for example Durista. So Durista is biodegradable eye implant containing bimatoprost, which is a prostaglandin analog, to reduce eye pressure in people with ocular hypertension or open angle glaucoma. So for the procedure, bimatoprost is housed within the tiny rod-shaped cartridge that is inserted inside the eye anterior chamber, which is usually in the front nasal part of the eye. That's all from us. Thank you. So is there any question? Anything from the slide or what we present before? Because if there is no question, we would like to ask you a question. Don't worry, just a simple question, just to make sure you understand what we present. Is that okay?